So I'm here in Belgium sitting with Dr. Luc, and we have just seen this amazing video on YouTube and Vimeo. And please, Dr. Luc, can you explain me something about this video?
Yes, the reason and why we were doing this video is basically to show that, first of all, the diversity of these particular cases. In other words, any case that presents is really going to be different, and I will give a little bit more explanation about that. But the goal really was to show the efficacy of homeopathy in, so to speak, non-curable diseases, which conventional medicine at this point considers a non-curable disease. And at the top of it too, consider these cases, most of these cases, that they really have an IQ of less than 70, which is basically disabled, learning-wise and so on and so on. What we want to prove is if anything, if homeopathy can help in these cases, considering that the cost to the parents or society per child in their lifetime is between $2 and $3 million, then anything needs to be done, which is the goal of conventional medicine too, to diagnose it as soon as possible and to interfere and intervene as soon as possible. If we can do that with something like homeopathy at the most early stage, and at the most early stage I mean not truly even curative but preventively, that we can advise people in their families. This is going to, when you have this particular method, you're going to try to avoid this or trying to avoid that, and therefore avoid and decrease the incidence of autism in your future child. It's all worth it. Even if it was only one child, that's $3 million right there. Even though we have now cases that are, so to speak, incurable, we really want to prove with homeopathy, as with anything else, that we consider the person with the disease, and therefore I really rather talk about a patient, a child with autism, rather than autistic children and so on and so on. What we wanted to also do is to really, I think it would be a wonderful PR tool for homeopathy in general, for good homeopathy, because right now it is always considered a placebo. And we have recently have enough attacks against homeopathy, as in the BBC lately, in Nature, journal Nature, and we certainly need to prove when we have a pandemic of autism, as it is right now, we really should be able to, with a case, even just one case like this, get the attention and tell the people, the millions of parents right now of these autistic children, that there is something else than what they already know. For the most of the time, most parents of these children are very frustrated. They really have tried everything because they are absolutely dedicated parents, without any doubt, and therefore they're desperate to look for anything. We just don't want them to go in desperation further. What we really want to do is give them a different solution and get them to know if autism is going to be the way for people to get to know homeopathy, well then it's the right way, because certainly at this point this is not going to go away in the next decade, and it's certainly only going to be increased. Thus for us it's an absolutely wonderful opportunity, and that was one of the main reasons I did, if not the main reason. I wanted to really demonstrate the efficacy of homeopathy, and hopefully that will open a lot of minds and hearts to homeopathy to the people, not just for autism, but for any particular other disease and illness that goes around. When we think about autism in general, and we go to the origin of autism with Leo Kanner, which was the first physician who basically coined the term autism in 1932, then he was basically, I must say, when you read his cases, there were 11 cases of patients that he had, the originally 11 ones. It is very interesting. First of all, he was an excellent doctor who described his cases the way a homeopath would describe it. And if anything, what conventional medicine should learn from it is exactly taking the cases as he did, which absolutely I found very wonderful. He was actually far ahead even of the people now, of the modern scientists, because at this point he really, when he studied the 11 cases, you can clearly see that most of the time the parents of these particular children were very well educated. In fact, there were 3 psychiatrists, they were very well educated people, highly educated, and he therefore deducted, that was one of his hypotheses or his reasonings or his causality, that for autism it must be that his parents were too much busy with their career and not giving enough warmth or anything, and basically he didn't coin the word refrigerator mother, but the society did on what he said. In other words, this of course became a backlash, because as much as he was right in some ways, he was also far too basically concentrating on that one issue. Although it was clearly to him that it played a role, and I must agree with him. But of course, as the time has gone on now, we are 2010 now, obviously we have realized that this is not really a one-dimensional causality, which in no disease there is a one-dimensional causality. It's in many. But what has happened now, the backlash was so great that now nobody wants to talk about the emotions anymore. And now only we want to talk about environmental factors. So because that is safe to talk about. I understand for parents how safe it is, because it's not fun to hear, maybe I missed something. These parents have already enough guilt that something they did wrong or whatever. And therefore now it has shifted completely. First, it went from the refrigerator model, emotional factors. It went to the genetic factor, mainly at that point, which is excellent for us in that terminology to look what is it really miasmatically, which is our genetics, to see what would this do. What if we look at all these cases, is there anything particularly common ground that we can look at it? And number three, before you knew it, because the geneticists didn't go anywhere else, I mean by 2000 we had basically the whole genome, we had it already figured out, and yet nothing happens therapeutically. So it wasn't, although there is still a strong consensus to focus on what genes are especially affected in the cases of autism, and we have already found 3 or 4, by the way. It is not a unique one. They would of course like to find a unique one. It doesn't happen, and they realize that this is not going to happen. Of course, what we need to realize too, that even if we had one unique one, it still therapeutically is not going to do anything for him, because we have done that already for other diseases. Therapeutically, really, unfortunately, conventional medicine has not been able to do one step therapeutically with the 30 years research we had about genes. So the shift again happened in the last 10 years. As you know, we went from the emotions, we left it behind, we went to genes. Now we actually go to environmental factors. And this is really, at present time, the one that really sticks out. What they talk about is the external environment. And with that, I mean, it has to be toxins, it has to be the bad air, it has to be the bad soil. So for them, that's the environment. And therefore, their whole research and what they're doing test-wise is only aimed at that. And their therapeutic gestures also therefore. If they think you have mercury, you have arsenicum, you have the other trace elements, toxic trace elements in your system, which we can find through blood tests, to hair analysis. To what extent they're all correct and sensitive, that's still debatable. But what really fails in this particular approach is that the environment is we only talk about a part of the environment, external environment. In other words, for the Chinese medicine, and even for us in homeopathy, we only have to look at the different aphorisms, and I will tell some. Then we also have an internal environment. And that's of course just as important as the external one. In fact, the external one will influence the internal one. What I really like is what happened in biology, by the way, at this point. And we don't talk about genetics anymore, we talk about epigenetics right now. Which means beyond genetics really, because what they found is that we can know the environmental factors, and that's how they made the link between the internal and external environment. A link that we have done already in traditional Chinese medicine 5,000 years ago, and that we have made also in homeopathy 200 years ago, is that when we have an environmental factor that is strong enough and long exposed, the patient long exposed enough to it, that it will actually switch off the genes, certain genes that are linked to a particular function, be it a learning function, attention function, that they can switch this off and then on again. Okay, and how long it stays off, who knows? But it's enough to stop the function. Therefore, if it happens, and this is what they found, and this is what I like conventional medicine, because their studies are good. And they teach me what, I can tell you why, because they confirm our miasmatic theory. I can use now the conventional, which I'm going to do, I can use the conventional studies to confirm our miasmatic theory. It actually is a wonderful proof that the doctors, the regular allopathic doctors, want to hear. And I say, but see, your study that you did, thank you for doing it for me, it actually confirms what homeopathy already said 200 years ago and traditional Chinese medicine 5,000 years ago. So that's why I'm really not against it, and I think we all should know about these studies and actually use it to our profit. So the interesting thing that medical science taught me that I can use in homeopathy for every case now for autism is that they actually found out that the turning off of the genes by an environmental factor happened at some what they call crucial periods of the internal development now, when the baby was still as a fetus in the womb of the person, or the womb of the mother, is that it's going to affect a certain function, particularly because during that time, let's say of the pregnancy, let's say the second and third month, there's a certain function that has to develop right there, be it the focusing, be it the speech, and so on and so on. The hearing function is one of the very first ones that actually happens. So it was very interesting for me to find a confirmation of what I was actually doing in homeopathy, what we are doing in general, that it was necessary to look what happened intra-utero while the fetus is unborn still, and what particularly environmental factors, if you want to call it, will turn off certain genes during what they called crucial periods. And therefore would be an explanation that, because they said too, autism seems to be an innate condition. What does it mean? It is present from day one on, not like infantile schizophrenia. Infantile schizophrenia starts later. See, I must say, there's a great common characteristics between those two diseases, and not easy, but certainly one of the biggest differential diagnoses is the onset of the disease. And unfortunately, several cases, a certain percentage of infantile autism will develop to infantile schizophrenia. But it's always later. But you see, because it is an innate condition, it means from day one on present. And of course, we also know in normal medicine, and certainly we homeopaths must concentrate on the beginning of the symptoms, that is day one on. And of course, we concentrate really pre-birth and intra-utero, but that they haven't gone that far yet, although a little bit. So we must at least pay attention to the symptoms as early as possible, because as conventional medicine, rightly, the earlier you intervene, the more success you might have to that it doesn't go further to whatever the disease will develop. The intensity of the, with autism, as we said, we call it neurodiversity, because basically you have 100 children, let's say, with autism. It means you have 100 different intensities, symptomatology. There is not one alike, of course, right? And that's probably one of the difficulties for regular medicine, if you think about it. So for us, it was good to pay attention. We can pay attention from day one on and see what we can do, interfere immediately. As good homeopaths, we should interfere. I call it even pre-conception. Okay, pre-conception. I mean, having both parents really treated so that what can we expect if we have two imperfect people to expect a perfect child? We're just playing a gamble and we have no idea. But preconceptional and intra-utero, and here again too, the advantage even of homeopathy above conventional medicine and even traditional Chinese medicine is that we can treat people intra-utero. We can treat the mother with homeopathy. This is absolutely, in fact, we should treat every mother with homeopathy while they were pregnant. Yeah, we have to really start, as conventional medicine rightfully has said so, we have to start as soon as possible, which for them is day one, postnatal. For us, it's certainly preconceptional and certainly intra-utero. And there's no doubt about it that even conventional medicine, to some extent, when I looked at all their studies, has really seen that they really need to interfere. And there are some studies now, which which are basically saying that we were right all along, that indeed now from 2000 on, in the last 10 years now, from 2000 to 2010, and actually there's about 33 studies on humans that they have seen when it comes to emotions and the effects intra-utero. And we talk about epigenetics again, turning off the genes and turning on the genes. And several hundreds of studies that they did with animals, especially with rats and monkeys, where they have induced pain, other emotions, and the effects on their offspring regarding intellect, regarding focusing, regarding bonding with it. They were very, very, I would say, compulsive and very wonderfully when you look at it. So we can use that as a confirmation of what we need to do and should do, and what we all along have thought that the real theory is, that it's not just the external environment, but also the internal environment, which is emotions in the first place. And that obviously when the genes can turn off, and we talk about the mental part now, not just the emotional part, if an external factors indeed can turn off genes, and it happens during any particular period that is very, very crucial to the development of any stage, a learning development, intrautero, then of course 1 and 1 is 2. We must logically conclude that it can start there, and we should therefore, now for us homeopaths it's wonderful because we can treat the person when they're pregnant. For conventional medicine, they know they can of course not give drugs, but what they try to achieve is that, which is good, it's a good start, is that they say, well, if at least if we can tell the mothers and the fathers about any possible factor, and emotional included, and try for them to say, you know, don't do this, don't do that. Create, in other words, a perfect environment as much as possible for the child, then at least you will be reducing the effect of having a child with autism. It's going to be a difficult task for them because you understand they don't have drugs that they can give, and parents are not always willing to return to the refrigerator theory that I talked to you from in the beginning, but they're going to have to look at it. So we cannot go to the extremes, which has happened right now. They either look at it only or they just completely deny it, because no such disease, we only talk about autism, and every disease is really involved with these different factors. So it's not just autism, you know, but I think for us, this case that we're going to present and that you see on the film is just a perfect proof for us, and that's for me one of the goals too that I had with making this film, is that it's not just for autism, it is just for every other condition that's out there, you know, and that it can be from everybody from the beginning of life till the end of life, and that means Alzheimer's disease included. So for us it's an opportunity to show this, that it can be done for every disease, and this is just for a patient with a disease, no? This is how we say it, that we don't be stuck on the disease. Okay? If the speech impairment is really the number one tool, the number one deficit, I would say, for most children with autism, then we must realize that everything else that comes out of it, what we call the cardinal symptoms of autism, like for instance, you know, the socializing that is not happening, the withdrawing that is happening, the echolalia that is happening. So then we actually can understand that these are secondary symptoms, and that the primary defect is really the speech problem, right? The non-development of the speech. Having said that, if we can therefore use the studies of regular medicine, of conventional medicine, that teaches us where is the speech development starts, where is, you know, intrautero, where does it start in the brain, where in the brain, left hemisphere, what exactly does the left hemisphere do versus the right hemisphere of the speech, what parts. Then we actually can use this to focus in homeopathy on those particular aspects. As much as we take the totality of the symptoms, then we must make sure to focus certainly on the speech defect, and therefore what we can look at it, in fact I did, and I'm going to be part of the lecture, is that I can look at all the things that I found in the conventional medicine studies, and I have about 18 to 20 rubrics that are basically saying about speech, what the speech is about wrong, what is wrong about the speech in children with autism, and I translated it in our language. And I was just curious to see, if I put those all together, what remedies are going to come out of the top of it. It's interesting for us to look at it. It doesn't mean that these are all the remedies for cases with autism. It can be any remedy. But certainly it's like for me saying, I'll be curious to see what can I see, what are the top remedies, and discuss some of them. So for me, by having looked at all these studies, I found it interesting here, like you can ask yourself the question, here is a mother who loves this, who wants to absolutely be pregnant. And why is this happening? Because most people are going to say it to you, right? I mean, yes, but you know, I did have nothing. I was happy. I wanted to be pregnant.
And she appeared to be happily married also?
Oh, absolutely. No problems whatsoever. Both absolutely welcomed the child with the biggest love. They're both devoted parents. They're both wonderful. So, you know, you can only imagine the grief that happens to people like that when it's so much, really, there was never any problem, not even intrautero in that way. But there has to be something else, as you understand, right? If this is, as we understand, when we talk about the internal environment, it is not just...
But I would like to ask you, is there a special approach to autism? Or is this the same, should you approach autism in the same way as you approach any other case?
Well, it's a very good question, right? And there is really not that much different of any other case. The only thing I would say, it almost should be easier because we get, first of all, the patient is a young patient. You know, most of the cases that we're going to get at this point still is, you know, maybe between lower than 14 years old. But that's not going to last too long. I already have gotten patients that are 23, 25, and with the way we are going, we're going to have to deal with the whole population that is in their 20s, okay? So in that way, what I'm saying is good about it, because if you get the patient even under 5 years of old, there's not that much still happening on the top of it. Once a child with autism, as we call it, becomes 7, 8 years old, and there is a certain degree of comprehension of, really, I would say, the patient understand, even as young as they are, 7 years old. They got embarrassed at school, they laugh at them. There is a certain knowledge and basically conscious about what something is not right about them. And they even feel it, because they can do things, they can eat the same thing, they can participate in anything. Children can be cruel, they tease each other. It becomes actually more complicated to understand, right? Because you're going to create secondary effects now on those children, and also on the parents now. And this is exactly what conventional medicine rightly showed in some of their studies, that they start hesitating. They say the symptoms that the parents and the symptoms that the children have as young as they are, like for instance, even when they were 1 or 2 years old, is it mainly caused by what then the parents go through, because it's so hard to raise a child like this? They have lack of sleep, the parents that is. It's every minute of the day they have to pay attention to it. So there is no doubt about it that there are symptoms coming to the child at that point. Secondarily, that has nothing to do with what we call the real mechanism of autism, of we call it innate disease. No, these are secondary, created by the family circumstances and the family dynamic, without any doubt. So obviously we have to take that in account. But for me, that study went too far again, because now it's blaming the child. No, it's like, and so it's not that. But we have to be able to divide the real pure primary causalities versus the secondary that come from the primary, obviously. And it's not that difficult, because we as homeopaths make a timeline always. We should be, and that's why when you talk about is the case differently than any other case, I guess in this case, children with autism, we need to definitely pay much more attention what happened pre-conception, just pre-conception, at the conception, at the time of conception too. What was the situation of both parents, mentally, emotionally, and physically? We are creating a human being, okay? What the Chinese call the essence, that means the strength, the vital force of both parents, obviously is going to play a role. So at that point, we must take that in account, so of course. And
so
then,
can I ask to be clear? So you mean the situation of both parents just before conception?
Yes. Well, I give you an idea. Let's just say that just a month before the woman gets pregnant, her mother died. We can't really think that the grief is already over. In fact, the fact that she is already in a grief situation, the fact that she's going to get pregnant and say, oh my God, and my mother just died, she'll never be part of this, even increases the grief. You see how one situation, preconceptual, can go into the pregnancy, and although nothing happened in the pregnancy, it actually increases the grief because it already was preconceptual present. What about, I give you another idea, I have plenty examples. What another idea, like the husband absolutely did not want a child. I have those cases, and the woman tricked her husband into it by, for instance, having sex on moments that she was the most fertile of all, and she became pregnant. And guess what happened? She announced the news to the husband, and he is absolutely raving mad. That particular case that I'm thinking about it did not talk to the mother for the whole pregnancy.
The husband didn't. Okay.
The husband did not talk to the mother for the whole pregnancy. So if we talk about a preconceptual factor, and then one that goes into the pregnancy, and we talk about when we really have emotions that are going to make a big difference, turning off the genes, which we talked about in epigenetics, you can imagine one of that duration and that intensity, where a mother is pregnant and really expects to help in the first place from the husband. And talking about stress, according to the stress chart that we have, the family dynamic, this family is really number 1 or 2 on the stress chart of 30, 40 factors, okay? So you can imagine, we cannot deny, we have to really look at it, that is going to be part of the epigenetics turning off and part of the history. As much as I don't want to blame anybody else, we as homeopaths, if you really want to resolve it, we need to know it. Therefore, the mother needs to be able to tell us. Without us, this is the way we have to conduct our interview, not giving them more guilt already than there is. But it's not like not thinking about it at all and not taking it into account and then thinking we're going to resolve it. It's not going to go neither. I have to tell one thing. The mothers are so wonderful that none of them really, when I explain it the way I explain it to you, really hesitates to actually give me everything what I need to know. Absolutely. In a way, they're desperate enough, I hate to say it that way. They absolutely want to help their child, that any communication they can do to me and any information that I can get, they really want to get. And I think that's wonderful, and we should, we really should take that into account to do good work that way.
I understand correctly. Your case taking is maybe the emphasis a little bit different, but in fact just as similar as you do any
Absolutely,
case.
absolutely. In other words, as you know, I hate the name, in all honesty, autism, really, because it's even an incorrect name. And it really was originally described not even by Kenner, but by Bloiler, who was the professor of Jung, so I know Jung very well, and he basically was linked to schizophrenia. See, so because he was so he coined the term first. Most people don't know it, but before Kenner. Kenner is, so to speak, the father of autism, but he actually coined it first. Autism, it comes from the Greek, within yourself. It means autism, okay, within their own world. And that's why it was coined, because it was really following the descriptions. So yeah, so for us...
So there comes the title of the
yes, from within without.
From within
without, yes.
Okay.
So escaping from the isolated world where these children escape. And for us again too, where conventional medicine rightfully looks for why did they do so, they really don't have an answer yet. We actually do. Now in homeopathy, we should have an answer. If you think about one rubric, when we describe a case going to your own world, one rubric should be delusion, of fancy illusions, because that's the escape in another world. Illusion of fancy illusions. We have at least 50 remedies in there.
And you mean to say that autistic children often have this?
Oh yeah, for sure.
They have this
for
symptom.
sure. But and the question is why? Why and for what purpose is always the main reason, because that's where we make a distinction, right? Because even 50 remedies, when we already have the illusion of fancy illusions, that doesn't mean that we have no other remedy that is not in this 50 that can be pertain to a cause of autism, but certainly there are definitely a great percentage. I'm not talking about the Asperger's, although the Asperger's can go into their own world too, and to some extent they do. Because as long as you're involved with their own world, they are okay. But if you don't listen to their own world, they are not okay. Okay? So that's one thing. And it's interesting for me that the therapies that are being done in conventional medicine now, and I will discuss them in my book too, is that they are basically, when they're somewhat successful, they are homeopathic in nature. Very interesting for me. Okay, so one of them is, I remember one of the studies or the methodology, it's a method, is that they really say we start where the child is. We start with what he has or she has, and we work with that, and then we evolve on that. So, wherever that is, trying to get that child out of their own world with what they have, not with a drug to push them or to push them this. So that was already a good start, but it certainly was homeopathic in nature. Other studies were done because the hypersensitivity to sound is so mainly present. So that is another thing. And here again too, this is why I want to make a bridge between conventional medicine and homeopathy, because their studies I can use. And when I talk about the hearing, why is this sensitivity, right? It's usually hypersensitivity, as you understand. Although here it is, they're hypersensitivity to something, and otherwise you call their name and they act like they are deaf, as you understand. Most children with autism, they always say you make a hearing test because they must be deaf, right? I call him and he just walks by you and he hasn't heard you. Yet if it's another noise, he'll do this and screams. So what is it? Here I found the answer from conventional medicine. See, so we should not just throw away everything. I'm very eager to learn from them, and I would hope they're eager to learn from us. But I'm eager to it because I can actually use it to confirm our homeopathic theory, and that's for me very important too. Because I know if they attack me, it'll be with their science. I know their science, so that's good, and I want to use it. So you start from a good purpose when you do that, because you're using their facts that they know, and you use it. So, and not only that, I give you another idea. They saw that in the first 24 days, this was a very interesting study I saw, that whatever happened to the unborn fetus in the first 24 days was of absolutely phenomenal importance. Now, one of my questions that I always ask, remember, how did you feel the moment you heard about the pregnancy? Day number 1, that is, no? So now you see the more importance even of that particular question and what happened during these first 24 days. Imagine, because people say to me sometimes, well, I only stayed disappointed for 3 days. Yeah, that's 3 days of the 24 days, by the way. You have no idea what had happened. See? Because they say, but I was happy for the rest of the pregnancy. See, so then they think, see? And that's why, of course, most homeopaths, and certainly not conventional doctors, do not ask anything about it, right? On the question, you know.
Now, regarding to remedies,
yeah.
Does autism need a special series of remedies, or is the traditional remedy, let's say, the polycrest, or the remedies you already know, is that, do you have enough instrumentum on this?
Well, absolutely we have enough. So in other words, here too, because if we start saying we need a special class of remedies, then really start saying then now we fall into the trap, because when somebody says that to me, that means you're going to treat a disease and you're not going to treat a patient with a disease. You know, the first law of individuality you already lose there. So you definitely cannot say that. The thing that you can say, that you can see, and that's just in the practice, is that certain remedies are going to be more present and more necessary for certain patients. But you know, that's for any disease, right? That's why we call them polycrest, no? Because they can be available for many particularly disorganization, diseases, no doubt about it. But no, we don't really need to say, well, these are the autistic remedies. There's no such thing. Okay, that would be coming again closer to conventional medicine. That's not what we want to do, not in that sense. We can use their science, but they really don't have the therapy. We don't have to get closer in therapy-wise to that and think we have specific remedies. You know, the specificity of remedies, I think you can limit to very few things with acute diseases, and even there we didn't like it. Harman didn't like it. If you think about Cantaris for urinary infection, for acute urinary infection, yeah, it's because it's so frequently forekoming, no? But that doesn't mean it's the only one, really, right? But it's almost a half-specific remedy. Certainly for chronic conditions you can say goodbye to that, because there is no such thing, because then you fell into the pitfall of it's a disease that comes on a visit, it's not a patient, so we don't really want to do that.
So in the module, in your video platform, there's also a video case of a boy with autism. I observed your case taking, and I'm a little bit worried that because you do so long homeopathy, you know so well on which symptoms to observe and which symptoms have a value and a not value. Could you again specify, how do you judge the value of symptoms?
Yes, well, this is indeed, and unfortunately we as teachers can fall into the pitfall when we know already for such long, and it becomes a second nature, of course, right? And it's not easy for us to go back sometimes by trying to, and I certainly give them the opportunity. But as you know, I give you just Margaret Tyler, what she said, and then you understand me. And Margaret Tyler says, the older I get, the less I wrote down. Okay, specifically because she knew exactly what to write down. So you tell me a little bit what you're saying to me too. Indeed, if students would be smart, they would actually watch me and see when I write something down, because then it's important.
Quite many symptoms passed by,
and
you just
I didn't write that down.
A few.
That exactly. Yeah, of course we call it about hierarchy of the value of symptoms, right? So this is very much ingrained. I mean, this is the importance, I think, for every homeopathic student to get the basics now, that you understand what does that really mean, right? Because why does he not take this symptom and he just take the other one? There must be a reason for it. And indeed there is a reason for it. So if they ask me specifically why I didn't do it, then there is a reason for it. And of course I can be missing someone too, there's no doubt about it. I can miss one and I say, hey, I forgot that one, it was important, and I'm glad you let me talk about it. But most of the time, no, I listen very carefully and I think, well, no, it's not important, or it's common, it's more common, right? When we talk about autism, here again too, if we keep on saying autism, and that's why I always say a child with autism, then we fall into, then because parents, when they come to you, they will say to you, I've done enough cases now, well, he has echolalia, he has, he just keeps on putting cups of tea in it, that's all he does, right? Okay, which was stereotype behavior, we call it, okay, doing the repetitive things all the time. These are common symptoms. What can I do with that? Really nothing.
So common, you mean common for this type of disease?
For this, yes, for this particular group of patients, which is an epidemic now, really. It's not an acute epidemic, because that would be the cardinal symptom. That would be okay. But we're not talking about an acute disease, right? It's a chronic condition, so we cannot say we're going to do the common cardinal symptoms, which we do for the genus epidemicus. We cannot do that for a chronic disease.
Because I noticed there's now a tendency to start to use normal, let's say, normal pathological diseases as in your analysis, and this is far from the way I've been taught.
Absolutely, and I would never do that neither. So, you know, there's definitely, in our regular, now von Böninghausen method is a special thing, but forget von Böninghausen now, where we do say pathology is one of the very lower things that we take in account, okay? But even very low in value, that is.
Unless it's peculiar.
Well, no, because it's pathology. We do take into account, I give you an idea, with von Böninghausen, seizures, convulsions, okay? So we have actually under sensations, general sensations, you can find the diseases actually. Fatigue even is in there, just as general as fatigue.
And you speak now about the Boger Böninghausen.
Boger von Böninghausen, yes indeed, not the pocketbook of von Böninghausen, the Boger Böninghausen repertorium, indeed. So, but we can't forget about that. We talk about in general now. So here, there's no doubt about it that we shouldn't have, and that's the really, I see this happening in modern repertoriums, that they actually start putting it in. Okay, you see Lyme disease all of a sudden coming. Yes. Okay, you see Hodgkin disease all of a sudden coming. I cringe, because this is really, for me, a pollution into it. Because what are we going to do? Like I say, how can we find stereotype behavior, for instance, in the repertorium, okay? So we still, how I go around this, and I think it's what we need to do in the homeopaths, with this particular case or autism, if you ask me the differences, is different from any other case. Not so much, but some aspects of my normal intake, I have to accentuate. And I give you the example. I have to accentuate the fact in saying to these parents, please give me an example. I keep on saying, please give me an example. Because why am I doing this? Because they're going to say something that's really more specific to their child. How do they do this? What do they do with it? How do they react? What do you say? In other words, I want to become more specific and individual, right? So it becomes a little bit different. I have to do it, I do this with any disease, really. But with parents, because they come to the office already, and they already have, they know you're the cardinal symptoms better than anybody else. No? They already went through it, they already went to the internet enough. So it's not helpful. Mm-hmm. And for us it's not helpful. So what are we going to do? Stereotype behavior. I mean, then you can close your eyes, and this is what alternative doctors who use the testing that I told you, who use vitamins, who do chelation, who do ozone therapy. Well, they don't even ask all those questions, but for them it's the same, right? It's all standard. You see how easy it is, really, versus what we are doing. So it's no different. Unfortunately, I would say, but if we could do it, we wouldn't talk about homeopathy. We couldn't say we do homeopathy. So no matter what the disease is called, if that's what we do, and I hear this thing, if I hear the dreaded word protocol, we are going wrong.
I also get many other questions. How often do you feel you need to refer back to isopathy? So vaccination, I don't know the English words, but to desensitize.
Desensitize is the word, yes, so indeed, or undoing the effect of vaccinations, you can just simply it that way.
Protocols that you need to 30, 200, 200.
Yeah, and you mean mainly isopathy, meaning therefore DPT, yes, right, or whatever. See, here is my question too.
How often do you use this in your practice?
I will answer that question, but the first place, it isn't as before anymore. Children get 9 vaccinations at the same time. MMR plus another one, plus the flu vaccination. If it's just a flu season, it's always just a flu season. So I wonder, even if you did isopathy, and I will comment on it, how are you going to do that? Okay, but we'd mainly say the DPT to make it simple. And then so after, because usually it's the MMR, after the MMR that in the 15th month, and that's a different reason of what they think, that the child goes down. I use that never, by the way, for instance. I use that never. That doesn't mean I never take into account that the child got much worse after the vaccinations. Because if you tell me that your disease got worse much more after a heartbreak, I have to take the heartbreak in account. No, this is no different. And then I have to have a heartbreak remedy. So if you get that much worse after a vaccination, then I did homeopathically, I need to have something that undoes the effect of vaccinations. And we do. We look under the generalities, vaccinations, we have at least 10 remedies there. There is black type remedies, italic, and so on and so on. And we should look in the first place for that. That's one approach. The second approach that one needs to think, because just those remedies is not enough, or it's not the only thing, I would say. Now, what does the vaccinations do? The amount of vaccinations we're doing to people, it creates vaccinosis, right? What Compton Burnett already said beautifully, it creates vaccinosis. So therefore, it's going to accelerate every disease. And this is indeed what happens, by the way. So the acceleration from psoriasis to psychosis and then eventually to syphilis is going to happen with each of these cases. So for us...
It just accelerates the tendency they already have in themselves.
Let me give you an example. What really happens is that I have no doubts that many children with autism have a certain degree in an innate condition, but you know what, it can be 10%, it can be just a small thing that is not well, that is easily overcome with even ABA, with behavioral therapy or speech therapy, because it wasn't that much. But now you understand, here it's already a little bit, but if we accelerate this process by the increasing vaccination, which I have no doubt about it, now you accelerate that process too, and where it would be otherwise a mild case of autism, now all of a sudden we have a lot more complicated case. You know, because here is my argument about the vaccinations too. It's not solely, as much as many parents say, this is a man-made disease by vaccinations. This is absolutely bogus. Okay, my first reaction would be the 11 cases that Leo Kanner in 1942 described, beautifully described. I mean, you read these cases and it's like you're sitting with the cases of today in your office. Okay, they're well described. They never were vaccinated, okay? And they were present. And who knows how many were present, no?
So to summarize, you don't see vaccination as a cause, just an aggravating factor or an accelerating
an accelerating factor, and maybe if it's really very strongly, right, then I might, so there is two different intensities I would see. This is very strongly, I probably need one of those 10 remedies that I find in generalities, okay? But you look at those remedies anyway, like sulfur, tuya, you know, silica, we talk about polycrest that can do quite a bit of things now. If not, if it's really already present from before and then there's a certain acceleration, certainly you know psychosis is definitely, it has to be an antipsychotic remedy. That's what it has to be. Vaccinosis is a state of psychosis. So obviously, I just check, what am I doing already? Am I giving a remedy already from in the beginning that is strongly psychotic, or was it not so strongly psychotic? Maybe I need to go back to the other remedy was close and that was me more psychotic. And then I might say, no, maybe I understand if I would do this now, it would actually work better. See, so there is a difference again from case to case, what you need to do. But I'm not going to do automatically, because then you can do it to everybody. Everybody got at this point in the United States, 70–80% we have compliance with vaccinations. Then I have to do it for everybody. I have to first do tuya, like I have seen, or whatever. And that is just, again, non-specific. Right? It's just really more, it's not even isopathic because you use a homeopathic remedy, but it's really non-specific. It's the individualization is totally lost, and you really have no idea. It's a shot in the dark, okay? And why this is so seductive, let me say, is that some cases indeed might have actually a little bit of improvement immediately. And sometimes maybe the whole case got resolved even. And of course that's what we're going to see. But that's just because it was completely homeopathically to the case, the remedy that is, tuya, let's say, right? Not because of what you were trying to do, but those kind of cases, and that happens all the time, and that happens since old ages, you know, they really will be then saying, hey, we should do this always because look what happens. We can go wrong, right? But what about if it's not indicated? What is a remedy what a remedy that is not indicated? You know, it's the wrong remedy. It's going to end symptom of the remedy on it. No, this is basically, we know this. So, which might probably convince those people even more, we need to give this remedy. You see how this really can go into a vicious cycle. So again, there is no specific rules that I wish there were. If there's anything different, I want you to know, is that sensitivity, and it shouldn't come as a surprise. You know, when we talk about sensitivity, we talk about aphorism 280 again, you know, we're talking about the sensitivity of the patient. That's something we need to look at as a class and population. If you ask me common factors, right, you ask me about remedies, is there anything, remedies more for autism? No, but what there are certain things in management that we really need to consider because they're a group of autism. first thing we need to consider is they're all syphilitic. It's the syphilitic miasma, it's the soil where this whole thing is bred upon. You know, the breeding ground of autism is syphilitic soil. Okay, that's certainly common. And the other common thing is the sensitivity. Okay, so when we think about the child that puts the hand up, this noises or whatever, it's basically what conventional medicine or look at it is like it's not a constant factor. For us as a normal person, we adapt to the sound, right? If it's really shrill, we would do this as a reflex, but you know, you and I talk, nobody does this. Mm-hmm. With them, they never know. In other words, it comes unexpected. So there is a change, there is a disturbance. And of course, we look at it at the point from neurology, there is a disturbance in this whole nerve ending. And that's why we can use, again, conventional medicine to understand all those things. Fine, but not really therapeutically. But what I really learned from it, and I have done it, again, from the practice, I have seen it, to my surprise, because at first I did not do that. Okay, at first I treated them just like anybody else. Right? So I think, good, how is this patient? The children usually are very strong and resilient, you know, and don't have not much gotten, although at the point that they came to me, they all have 40 supplements, 40, okay? They have done a lot of things, unfortunately, and medications. But still, it's not like like some patients come to me and say, boy, I can be in your room because there's carpets in it, you know, this great sensitivity. But certainly one thing I needed to adjust, and I saw it because I followed the management, and I say, I can do this, I'm surprised. And I need to actually take into account that I need to not start too high. I never do 30C, but even 30C it's almost too much. Or I need to take this into account. So I would call them as a common factor hypersensitive, if you want to call it that way. So this becomes, and on the top of it, now if we apply aphorism 280, remember where it says sensitivity of the patient, but also the nature of the patient, it says the nature of the remedy and the nature of the disease. Mm-hmm. Now you have the three factors. And I really indeed, that's another thing that in autism I need to pay particularly attention to it. In other words, the nature of the remedy, which I can really honestly say with all the other conditions, patients with conditions that I see, I don't need to take it into account. I do take obviously the sensitivity of the patient in account, the nature of the patient, as we say it, right? But the nature of the remedy, no. But here, yes, very much. I mean, if I have a tarantula case, for instance, there is no way, if I have to be extremely careful. I give you some idea, I have had several tarantula cases. And to my surprise, and thank God I do the management the way I guess we should do it, I give one dose, and then I let them get back to me the third day before they do anything else. And that's the only way I discovered it, because I would not have known it otherwise, is that I saw this case and I gave one dose, and a very minimal dose, 30C, no succussions, one drop. And in fact, I had to really get the dose down with those cases too, again, the amount. And I did with tarantula, I realized I need to forget a half teaspoon from the bottle in a 4-ounce cup, and then a half teaspoon from the cup, forget that. It's tarantula, 2 drops, 0 succussions. And then, to my surprise, they did well for 25 days. I was totally surprised. I would not have, and in a way it's like, oh my God, I'm surprised. So what they needed to say after the third day, wait. Mm-hmm. Wait, and email me back in 2 days further, because I think it can happen anytime. No, the first time I have no idea how long this is going to last. So I had to say, wait. And you know what happens when I have a tarantula case, I already know, I said, I have to let these people email me every day. That's why I got a lot of work. Because I can honestly say I would have lost more than half of these children if I wouldn't have followed that the way I did, for sure. Because you look at this case and you would say, well, like all the other cases, or regular, not, okay, you figure it out, maybe every third day you dose or whatever. No, forget it. Mm-hmm. They will do 25 days or longer.
Yeah. So, and now you mentioned the topic potency and dosing. If I understood correctly, you still prefer to use the 5th edition of the Organon in 70% of your cases, and you use only LMs in a smaller percentage.
Yeah, well,
and the dry dose you only rarely now and then. Almost never.
Never.
Why do you prefer the 5th edition, so the C potencies in divided doses, above the LMs?
Yeah, because there is a reason for. So initially I knew the 6th edition before the 5th edition, so I became very well versed in the LM potencies. But you know, I also became well knowledgeable about the dangers of it. Okay, about the dangers when it's in the hand of the patient, because that's basically what you do. You give the remedy to the patient. And you know, no matter what you say, if they feel good, they're going to do things you don't want them to do. Even if you say to them, don't take the dose now, it's not necessary. It happened to me. So, in other words, first of all, the LMs, which, by the way, in my opinion, are still the best method of Hahnemann, are extremely fast working, but if you don't have an excellent knowledge of the 5th edition, it's always going to go wrong. To some extent too, so I didn't know the LMs even before the 5th edition, and I knew them very well, but I already knew the danger from the patient. So when I found the 5th edition, for acutes of course it was perfect, and I wish I would have known that earlier.
So for acutes, which is perfect for
C scale, the 5th edition, C scale, right? That's perfect, right? I mean, no doubt about it. I wish I would have known that, because before I did the dry dose with acute diseases too, you know what I mean? So, but no, it's absolutely fantastic, and no homeopath in the world should do ever dry dosing for the acute. But we talk about the chronic cases again. So for me, the speed in which LMs can do, and you know, again, that you understand it as the homeopath is one thing, but that the child of these mothers who are very protective of their children, that they aggravate all of a sudden, and it's the first time they see a patient or they see you, it's hard. I mean, it's hard not to lose them, okay? So for me, it was a lot easier. It's not gentler, but it's not as fast working. It's not gentler, but I can make the gentleness as good enough, because I'm going to remember, adjust the dose, remember, and the potency. I start with 30C, but the dose, you know, for between 275 and 276, it's very, very important that the dose is as minimal as possible. You know, so for me, I totally take that into account.
So you feel that the 5th edition with the C potencies is easier to adjust the dose, and LMs more difficult?
Yes, it's easier to adjust the dose for the patient, to get you the, you know, again, because you depend on the patient, no? You really depend on the patient, what they do, what they observe. If I had them in the hospital, I would have no problems. I would just start, and again, still in 30% of the cases. But I must say, even Hahnemann in his Paris cases was building up to 30C and then switching to LM1 or anything like this. And the most amazing thing, because they are this sensitive patients, we're talking about what is different about this class of patients. Because they are this sensitive, I cannot right away get to LM most of the cases. I cannot get it because I would aggravate them. I already know that. So I need to get something lower than LM. This is 30C. Oh, so and that really is one of my main reasons that I don't start with LM, but many times I went rapidly, and I mean with rapidly I mean the second month, third month to LMs.
Make it clear for our viewers, so an LM1 you see higher than a C.
Oh, for sure, for sure. It's more penetrated. We always say about LMs, they are more gentle working and more penetrating, but you know, what do these words mean? More penetrating, very fast working. You know, that means very fast healing, but I would say, yeah, more gentle. Right, wrongfully this has been translated as like I can just do whatever I want, because I never will have similar aggravations. You'll have something coming to you if you think that.
So if the patient is sensitive or in autism?
In general, patient doesn't have to be even more when they are sensitive, even more. You know, and this is the point that I just want to make, because you make it right. You connect the two now. Here we have a class of sensitive people. A reason to more for me that I give you the example. Imagine the rental case that I mentioned, and I give an LM. I'm going to go wrong from the first dose on, and you know, you already have a tarantula case that is volatile in nature, no? Imagine how am I going to correct this? How am I going to bring this storm, this tidal wave to rest, okay? I have to wait 2 months, a month? Yeah, but you know, people are going to say, hey, look what that happened, look what he did. I mean, he just got so much worse, and you lose the patient, no? So you have to really be careful. Like I said, if you have them in the hospital and you have them under your control, it's a different story. That's not the reality.
Okay. Can I ask you just a sideline? You mentioned Hahnemann and Paris, his Paris time. I know that you have been studying the actual case books of Hahnemann.
Not the case books, I actually have the microfiches.
The microfiches?
Yeah, from the German, I got them from Germany, where I had the microfiches. So you see his handwriting, or Mélanie's handwriting, mostly in French, I want you to know, actually all in French practically. It's in French, it's not in German. You know, in Germany they have two and think they have about 2 volumes that they did translate in German on one side, and on the other side it's French. But it's basically in French, so you know, if you...
And there are a lot of strange rumors going on that Hahnemann at a certain moment start to give everybody sulfur, or yeah, those things. Did you come across this? Or?
No, I, on purpose, because I know about these rumors, right? On purpose I said, I'm going to follow once maybe 100 cases of his. And so I have a certain percentage of how much did he use sulfur, how much he used this, this and that, right? And I just did this. First of all, people who say these things, my first question would be, so you speak French fluently? If you don't, you just invented it, because how can you? You can only read it in French, okay? So, you know, this is very amusing to me, how people who absolutely have no idea about French are spreading the rumors to start with. So, but I did it on purpose because there's so many other rumors, right? And he never used anything more than 30C, or he never used 200C, you know.
I read already in the 5th edition Organon there was an XXX, so a C90.
Yeah, absolutely. In the 4th edition, before he wrote the 6th edition, he already used 60C, 60. I have cases, 60, and 100C. Okay. That was before he wrote the 5th edition, before they commenced. So, but to answer your question, yeah, basically, I found, why did he start with sulfur that much? When I did to give you a percentage-wise, right, and I think I write it in one of my books, you might probably think about 65% he started with sulfur. But why is the reason? It's the reason 7 out of 8 diseases at his time were psoriatic diseases, were totally psoriatic. You know, it would be foolish not to even open with sulfur. Polycrest, the king of antipsorics, okay, and therefore the mother of all the other miasms. Yeah, but if he had the case of gonorrhea or syphilis, he didn't start with sulfur, I can tell you that right away. Right? But we're talking about the other chronic diseases now, right? But all the other ones, the 30%, 35%, were the different remedies, no doubt about it. Okay? So, but he had a reason. Would we do that now? No. Right? If we think about what is now the mean miasmatic state, it's psychosis in the first place, and cancer, unfortunately, is the mixed miasmatic state in the second place. That doesn't mean we're going to give everybody carcinosum, but to tell you the truth, in reality, many patients at some point in their treatment do have profit from receiving carcinosum, no doubt about it. Right? So, but now it's more psychosis, but there are reasons. There's always reasons for. If Hahnemann would be alive today, he wouldn't practice differently, but he would probably dole out the kind of remedies he would need would probably be differently. His openings move, so to speak, would be different. I have no doubts about it. But one thing he never would do, which we never should do neither, is just throwing everything about homeopathy away, about the principles. It's always based on principles, right? Even in my practice, even the last year now, will come as to a surprise, the last 2 years. Even what I wrote in my last book, I have gently changed, smaller changes, but they are small changes only because they're practical, because they're linked to the clinic, what I see. They make my life easier, they make the life of the patient easier, but I have never omitted everything else that preceded it. It's just a slight adjustment, I would call it, right? So a fine-tuning, probably a better word. And I think we need to do that because, yeah, as people say always, yes, we have a different kind of people now, different generation. But yeah, but that doesn't mean we have to have a whole different theory of homeopathy now. We need to adjust certain things. We certainly have more difficulties treating people now, no doubt about it.
Now, can I ask you another very hot topic about miasm? You mentioned miasms. And I speak not about Sankara miasms, but the traditional miasms.
Yes.
I've noticed there's a tendency to prescribe the nosode if you see the patient belong to a certain miasm. So I know you explained the whole topic in your first book, Hahnemann Revisited, but so you always do a miasmatic diagnosis, but it doesn't mean you immediately start with the nosode.
Yeah, so don't forget, I think there's something that most people forget, that every remedy is 3 miasmatic, all of it. But to what extent, right? You can have a 3 miasmatic remedy that is 1% psoric and 98% syphilitic and 1% psychotic, but it's still 3 miasmatic.
Okay, so it fits all the miasms.
Yeah, so it always is. So when we say, yes, we're going to look at, definitely the miasmatic diagnosis is part of my selection of my simillimum. I need to know this. What is the dominant miasmatic state of the patient for sure? And because, as I just said, every remedy has the three miasms in each other. So if I have now, say, the dominant miasmatic state of this patient is psychosis, and I have at the end of my inquiry 2 remedies, and one is strongly antipsychotic and the other one is strongly antiepisodic, you know what I'm going to choose, no? Logically, I need to choose the antipsychotic.
So the first way you use it is that when you have to differentiate between 2 remedies, which you prescribe based on the actual symptoms,
Yeah.
then you say, if you cannot decide, okay, I give the one that is more matching the whole miasmatic diagnosis. That's one way you use it.
Yes, I mean, you just talk about miasm, right? Because I take all the other things in account too, obviously, right? I mean, it's my selection of similarities is not just linked on or based on the miasmatic diagnosis, of course, right? I make many different diagnoses and they all come one thing. And every aspect of the diagnosis, and there are 4 or 5 different diagnoses, I need to take that in account. And that's the remedy. But it is an excellent tool to when, as we know, often we have 2 remedies that are so close together, it always happens. And now we always know what's common, but what's different is the difficulty that we need to match it to the patient, right? So that's where definitely that is one tool, because if you choose it, and certainly all the great masters, Hahnemann, Hering, and even Kent, you know, use that tool to say, you know, if we do an anti-miasmatic prescription, we certainly have a much more deeper working and action, long more acting and deeper working than when we don't use this thing. So there is a reason for that too.
But still, you decide on the actual symptoms you see in the case.
Yes.
Okay.
Right. So because that is so, because if you want to explain that, each symptom has a miasmatic denominator. Right? If you say the child strikes, but that's a syphilitic action. If you say this child weeps and wants to hold your hand, that's episodic action. So we really make the whole content, and you have the whole picture. Then you have the sum. It's like a puzzle.
About miasms and the nosodes. So one, I understand you use the miasmatic diagnosis to be able to differentiate between 2 remedies if you have there difficulty with. And what is the other use of the nosodes?
There is about 11 uses, but the one that is really mostly used, and when you mentioned to me, you know, am I using it when the case gets stuck? Now we call it intercurrent nosode at that point, intercurrent remedy for a chronic disease, which is a nosode then. It's a possibility, but one has to be very carefully, and in the advanced book that I wrote, you know, the last book that I wrote, I had to really make this book again too, because it adds more, in just what you asked me actually, is that most of the time when we get stuck with a case, it's not the first thing we must think of that the case is stuck because we have a miasmatic overload, okay, there is too much poison. I mean, it can be, in many cases it is, but the first thing, I must here agree with Kent, and not agree with Kent that much, but here I must agree that usually what happened with the case gets stuck is that we did not actually increase the potency sufficiently, and it has everything to do with the vital force that is actually stronger because you have done the right job, and we give it not a sufficient stimulus to get it further. If I start not pushing hard enough on a strong vital force, it becomes an irritation for the vital force, and therefore it's not going to happen. On the contrary, in the case it gets stalled. So before we even think, and this is really, I would say, a management tip, I would say, before you even start thinking first about, do I need a nosode to remove the miasmatic block? Once you think, did I actually increase the potency enough to get the vital force going forwards first, before you might think, if that doesn't happen, you have done that, then you must think about the miasmatic block. Then you can really think, yeah, maybe it's a miasmatic block, and obviously the nosode is selected then according again to the state, the acute dominant, to the chronic dominant present miasmatic state, and not something that what's happening intrautero or even in the beginning of life. No, what is it? What layer does it belong to? What miasmatic state? And so that's basically what we're going to do, and we have to select it that way. So that will bring up the symptoms. And another one that is very close to what you say, another indication is when we have paucity of symptoms, when the vital force is overwhelmed by the miasmatic poison and can therefore not bring enough symptoms. Obviously we can't prescribe it because the vital force has not given us enough information. At that point we actually, because we won't see the remedy picture, because here we can see the remedy picture, we cannot just really prescribe it. At that point we'll actually start with nosode, because it will relieve the vital force enough that it cannot throw up symptoms, and we can now prescribe on it. But you see, therefore, when we give the nosode, it might improve the situation without any doubt. But we also need to keep looking for the remedy picture that will show up while we are doing it. So we're not really giving a dose of a nosode every day for the next 3 months, because the picture, you know, this best way of adding symptoms to the patient, but certainly very selectively, like we do it really with any other remedy. You know, more even careful with the nosode because it is more of a noxious material. We have to be more careful, the repetition that is, and less frequently. And we need to look always out, as Hahnemann and Hering said, even the father of nosodes, Hering, proved some wonderful things, psoriasis in the first place, that we have to always look. He said, a nosode never does cure a case. Okay? There is only one thing, if really the nosode would be the constitutional remedy, but that is very rare. Mm-hmm. Otherwise it will not cure. The remedy, it has to be followed up therefore with the indicated remedy. But it can do a lot of good things, obviously. Mm-hmm. Yeah.
Okay. So now about the video we've seen. So I understood you were going to present us the case, so maybe a paper case, so we can study it, and you will later on comment on it, do the analysis for us.
Yes, this is probably the best way, as we could do obviously always, is to, because it's going to teach us the management. You know, there is no such thing, at least not in my books, in my practice, and in many other practices, Hahnemann included, that you give one dose of a remedy and the case is resolved. Okay, so that really never happens. Even when I look at the Paris case of Hahnemann, I saw him struggling with many cases, as we all do. You know, after 2-3 years and still struggling, and he's the master, so I don't think we are any better. We do struggle with many cases, you know, partially sometimes because we don't get all the information, partially because we never obtained the information because of our own fault. I don't always blame the patient. We didn't ask enough pertinent questions. We didn't have the right insights. Sometimes it's like any detective story, right? How many cases of murder do we have? And all of a sudden we get a piece of information and it broke the case, so to speak. It's the same thing. You know, we don't have to be, I know many consensus homeopaths really are hard on themselves, myself included in the beginning. I was very hard on myself. Did I do something wrong? Did I do a mistake? What did I do wrong? What should I have asked? You know, this again, it's a whole pieces of puzzles, and we don't always get the whole thing. So that's really the difficulty of it. But
so I have another question. You know, nowadays the students who come from a school are confronted very quickly with all kinds of new theories and new methods. Probably some very interesting, and some will have some merit in it. But still, what would you advise someone who comes off a school to dedicate it your time on, so you have the maximum effect? And that's one. And secondly, where did you get all your knowledge? Which books did you study?
Let's first with the first question. So I like all novelty in a certain sense. I like all novelty as long as the old stuff, where it's based on, or where our theory, you know, it is a science. Homeopathy is a science. It has more than a science, because it truly has nature's principles and laws, without any doubt, infallible nature's laws. So that really has to be always based on it, for sure. So does that mean we don't never want to do anything new? Not at all. But you know, what we need to do, how valid this is, we need to really be very objective about it. I surely rejoices with anybody when you cure a case. I don't know however you do it. But it has to be, remember, in science, we have to be duplicate the thing. Remember, in science always, it's only going if you can duplicate it. Not just if one person does it. Then actually they forget about it, because they think it's biased. Even in conventional medicine, many studies get thrown out because it's biased. They really, I mean, they're really that honest, because they can duplicate it. Okay, in different centers and everything like that. It's the same thing, right? If we are sure about certain things, we need to be able to duplicate it. If I teach you something, you have to be able to go home, if I teach it well, and duplicate it because it was the truth based on normal scientific laws. Then it's okay.
And where did you get your knowledge? Which books did you study? Which books you think are good for a student to learn?
Well, they can't really do what I did, unfortunately, because I was lucky. You know, I got very early on in my education the advice to go to the old libraries in Ann Arbor, Michigan. Okay, and they have in Ann Arbor, Michigan, they have all the journals of homeopathy from 1830 on till now, every possible one. And so I went there several times, the whole week, made copies from morning till evening for 7 days in a row, and took those suitcases full of papers with and studied line per line. So obviously I was lucky enough to be able to sit with those masters and read about it and got good advice. But so since this is not possible for everybody, I would probably say there is no doubt that the Organon and the 6th edition, but let's not really stuck with the 4th edition really, since there is a 6th edition. Let's just really truly discuss this, because I hear everywhere that they have read it, that they have studied it. But you know, when I then bring one of my books out, which is entirely based on the Organon and chronic diseases, this is the second book, then they always say, but why did you get this? Boy, and we did study the Organon too, we didn't see it. Then we have to start thinking about how did we really teach this, right? So maybe not good enough. Maybe we should stand still with it a little bit better, discuss it a little bit better, apply it actually to this is one thing I would like to see, that there would be, and it's one thing that I might still have to do, but something that is more applied to the modern times, if you want to call it that way. And it would be nice to see every aphorism with an example behind it and even adjusted to the modern times. I think that would be very valid for the student, because you know, when you read the first time the Organon, it is very difficult. Now you read a lot in language that is really old, and he has his own words. You know, you read the first time Jung, and it's very difficult because he has his own terminology. So that really makes a difficulty. So I think it would be ease the students in, but they are essential for every student to study those two chronic diseases too, to have the basic. And I think when teachers should do, I always try to do that in my school, is to bring it to the language of today, and with examples, because that sticks with the patient, with the student. So that way they wouldn't look at it and say, oh wow, that's something old. I can understand this archaic language, which is to some extent is, but you have to get used to his language, and we can translate it a little bit better. I think as teachers that's going to be our duty to do, to really get that a little bit better off. And then because we give examples from the present state, then you can clearly see, yes, that's really true. It's really true what he says, because it comes out in the clinic. You know, you clearly can see it. So for me, that was the most important thing. Like I said, I was very lucky to be able to, and I still do. I still cherish old literature that I can see. Wonderful practitioners that we have had in the past, like Margaret Tyler, you know, like Dr Schepper. He was a fantastic physician, you know, just somebody who worked in the countryside. But you read their cases and it's absolutely fantastic. Compton Burnett, I mean, I have so many favorites. You know, you read their books and they are fantastic. And so for me, once you have the basics though, that's what you can build on it. And so anything new too, it's okay. But you know, when it's really deviate from the basics, it really has nothing to do with homeopathy anymore, then call it whatever you want. Like we have many eclectic doctors, right? Eclecticism, this was not homeopathy, but it wasn't conventional medicine either. Mm-hmm. But you know, and so I probably would say it was much closer to what we call alternative medical doctors now. Alternative, and I really don't want to be grouped into those neither, in all honesty. Yeah.
So you mentioned a while ago the rubric which many autistic children have. Could you do a short differentiation?
Yes, this is a fantastic exercise. Delusions of fancy illusions. Okay, and in fact, I'm teaching a PhD course now, and one of their homeworks is exactly what I'm going to do for you to some extent. Okay, mm-hmm. Because my question to them was: here you have 50 remedies. You know, it really means this is escaping in your dream world, okay? So when you escape in your dream world, there has to be a reason for why do they escape. So I call it a theme, right? What is the theme of the escaping? Why did you escape? So if you have 50 remedies, as you know, each remedy is for a different reason. But the nice thing about this rubric is when you look at it, that there are at least 7 themes in it where you can group in the 7 themes. Let's say I can group 3 or 4 remedies in one team, and another 3 or 4. And when I mean with a team, I'm not talking about family groups, or I'm not talking about botanical groups. No. With a team, I mean they escape because, let me give you an example, because they are very fearful of what happens in the world. So you know, I'm very fearful. What I'm going to do, I'm trying to create my own world so I can stay in my own world, so not to cope with the dangers in the outside world. Okay, so that's one team. right? So we have different teams now, 7 actually, when I looked at this. And I wanted to group that in there. So the group, each remedy can be in one of those teams. Okay, so the loneliness, when we talk about it, the loneliness, you know, so when I want to be having support because I'm afraid. Now when you look at remedies like stramonium, pulsatilla, well, they're going to go be both into that particularly delusions or fancy illusions, and they're going to be black type. But you can clearly see that they have something in common, no? So when you look at it, it's based on loneliness, because if you even look at their, what I call the core delusion of stramonium, which is delusions of here, the world is full of wild animals, okay? So delusions is all alone in the wilderness, basically, that's what it says, right? So that means it's extremely scary. It's not just I'm alone in a really a very severe, bad environment, in a dangerous environment, and you compare it with pulsatilla, delusion, I'm all alone in the world, but not the scary world, but I'm all alone in the world. So here you clearly see they both escape to their, it's almost the same team, because they want support, but even there is a difference. But they can be in the same team. So even there is a difference, because with stramonium, they need that absolutely holding the hand. And you know, especially at night, obviously, when it's dark and so on and so on, we know all the keynotes of that. We need to hold the hand, because we need to basically, I don't dare to step out of the door. Pulsatilla, on the other hand, no, they want always somebody there. The neediness of the pulsatilla and in the neediness of stramonium is a different nature, as you see. The neediness of stramonium is based on the fear for the environment, especially when it gets dark. The neediness for pulsatilla is basically based on I want to be paid attention to. Mm-hmm. And this is very different. Okay, it's not based on fear. It's based on, if there is any fear, and then it's based on fear of being neglected. No, don't count me out. Don't talk to you. Don't talk over the phone. These are parents talking over the phone, and the child can't stand it. Okay, you didn't need to pay attention. I have these autistic children who basically say every minute of the day they need to be entertained. No, see, so the different thing, but there is certainly a need for support. I call that particular team. Mm-hmm. Okay, and therefore, if they don't get it, they go and create their own world.
Can I have a moment to zoom in on the rubric?
Yeah.
And we have the...
So I'll give you another team, right? And we look at it, right? Because we look now at the black type remedy here.
So we're looking here at the mind delusions.
Mind delusions or fancy illusions, right?
Illusion. What does it actually mean, this rubric?
Yes, so you see, it's delusions. As you know, delusions are fixed ideas. Illusions are make-up thing, make-believe thing. And it's fancy illusions. It's make-up, belief of fancy make-up things. Okay, I want to create my own fancy world. Obviously, when they create their own world, it's not going to be a bad one. It's going to be one that is better than the one that they were in. Right? They escape because this is too horrible of a world. The world of adults for an autistic child is too horrible often. I want to therefore create my own world. One that is very fancy. And they're all illusions because they're really not based on anything. Illusions usually where the child, depending on the remedy again, where the child is the king of their kingdom, so to speak, right? And they have their little things, you know. Do you remember, you can really see with many children with autism, how they have to carry a little thing in their hand. Mm-hmm. It's like a little animal, 2 little sticks. I read cases, or I have had cases, they're 25 years old, and they're, so to speak, normal, but they can't speak yet, but that's a different story, but they can communicate very intelligently, mm-hmm. and they still have to walk around with a little plus baby or a little bear, okay? So again, so these fancy illusions, it's still fancy illusions because it's not a real world. It's not a world that is connected to the adult world that we have right now. That's why we call it delusions or fancy illusions. So if you look at it, that is another team, you look at remedies like Haesiamus and Ignatia, right? And Lachesis. Yeah, Haesiamus and Ignatia, right? So the 2 remedies there, when we look at the team, obviously, there is a theme of grief, even the theme of grief and jealousy, actually, too. I mean, that are together, because when we look at Haesiamus with their core delusion, that delusion is going to be solved, versus Ignatia, I am pregnant, and you know, so, and with your baby, that is. Okay, so then we need to think, well, there is a difference again, right? Although they belong to the same team, but I said already, the original team, grief, for sure, and jealousy, both. because again, the way they're going to compensate on this core delusion is in that sense the same way. Look at Haisiamus, who is basically says delusion is going to be solved. And here again with many children we have, because this starts very, very early on, earlier than Ignatia anyway. Okay, with Ignatia as a grief, if you do the difference between the two, Ignatia, you have to have an ego that is developed already to understand an Ignatia grief. Haisiamus is a very primitive grief. See, there's a very different thing there. With Haisiamus, it's innate, ingrained almost, because with Haisiamus, as you understand, we have a rubric, grief, and when the newborn has arrived, okay? You know, jealousy when the newborn has arrived. Okay, so you clearly see we are dealing here with a very primitive ego from the person who is going to go to Haisiamus. It doesn't mean, by the way, that an adult cannot need Haisiamus, but it certainly is an expression of a primitive ego, even when it's an adult. Okay, so you are stuck somewhere anyway, because it's based on and it creates severe jealousy, following with violent acts on the top of it. You know, killing, striking, killing with a knife specifically. So this is very important for us to see. So when I see Haisiamus and I say, let's look at all the delusions of Haisiamus, there's going to, of course, be more than just one delusion. And I need to be able to find which one is the core delusion, which means really the center, the beginning of the story of the patient, and how, you know, what will happening if the patient stays with it. In other words, secondary delusions are going to be followed. So with this particularly fixed idea, how do I find it? You know, that is particularly the core delusion. There are many different ways of finding it. There's about 5, 6 different ways. That I actually put criteria for, right? I need to find a criterion. Why do I choose this as a core delusion? To say one thing, for instance, if this particularly, if jealousy, there are many delusions, delusion of Haisiamus is wronged, okay, black type. Now again, too, if Haisiamus has said, I say something for reason 6, which is not the case now, if it has 10 delusions, one of them is only black type, then automatically becomes one criteria that is probably the most important delusion. But I need to still confirm it at that point that it is the core delusion, because often a core delusion is confirmed by other delusions of the same remedy in the provings. See, so there's about 7 criteria, and most remedies, before I deduce from that it should be the core delusion, in other words, really, if I say about this core delusion, I explain it in one sentence, like what I did here, what you see on radar here, then it's understood by everybody that it's the essence of their suffering, and it's kind of understood. But usually we have the other criteria that I created that can confirm actually the remedy. So it's just more than one, and which I like. And often more than one criteria, and I will give examples later, can be found in the remedy can be found in more than those one of criteria, which makes it even more valuable, right? So then you're more sure about your selection of that delusion as the core delusion.
Do you ever prescribe solely on this core delusion?
No, absolutely not. Absolutely not. And the basic reason is for that, and I think it's really well done here in the module, that the core delusion is not just the afterthought, it's the last thing that you actually come to. You know, you really started, as we should do, from the chief complaint. You build it up, you go to generalities, you go to emotions, you go to sleep, you go to sex, you go to aversions, and you go to everything else what we always do. And basically it is built up in this particular model as such that it does the work for you, because here are the top remedies and what are the core delusions. So saying that I only base it on core delusion is not true, because I found the core delusion simply because I base it on everything else. So it's impossible.
So it's during the case taking, you see everything, the normal physical symptoms, you take the generals, you take the emotions, the emotions, the delusions which are far away from the nucleus. Absolutely. And then you try to see this core delusion and see if it matches everything else.
Yes, because it is my last thing I look at it, right? And here in this case, the computer does it beautifully for you. Here are the top remedies delusions. The good thing about it is, because I gave the explanation of it, or you can go back to the rest of it and read even more about it, you can clearly say, you know, not always, as you know very well, the top remedy is the indicated remedy. This might well be number 3. But you know, if you go to the top 5 remedies like we do here, and we look at the core delusions, and then we say, you know, when we read this and we read more about it, we say it's very easy, and it's a very wonderful tool to say at that point, this particular explanation of this core delusion that really fits the history of my patient very well when I look at it. See, but it's based on the totality, absolutely totality of the symptoms, because you're using it as a tool to distinguish, and it's one of the greatest things I think about finding the core delusion of your top 5 remedies, or knowing it, that you actually can distinguish. For me, it has helped me tremendously before. Later, that is, once I knew it, because it can be very difficult, you know, to tell you the truth. Do one's net muur and lachas case, okay? They are extremely difficult, as much as people think it's not difficult in the clinic to distinguish, they are very difficult. But when it comes then to the core delusion, and you look at it, and you look at the history of the patient in its totality, then it becomes very clear. Okay, so that why it's really wonderful.